Hi, Belen. Good afternoon.
Good afternoon, Miss. How are you?
Fine, thank you. Here is raining today a lot.
Yes.
I don't know if you're still here
Yes,
or
yes,
have you heard the thunders?
yes, it was very strong.
Yeah, that's right. Okay, I'm so sorry for rechanging the schedule, but Ale had some problem with his internet, so I tried to make it better, but you have things to do. Okay, let's talk about yesterday's class. Can you explain the taking blood procedure?
Okay. Can I explain like I know or like it was in
Yeah,
the
no, sure. Like you have experienced.
Okay, first of all, we have to talk with the patient and tell him that it's not gonna hurt so bad, but it's gonna be like a bee when a bee it's not bite, it's a bee. How can I say? Miss, how can I say it? When a bee,
La picadura?
yes, but it's not a bite. It's like
Yeah, let
another
me check
word.
that. Okay, continue. Continue while I'm looking for.
Okay, and then that we talk with the patient, we have to put to make the asepsia in his arm. You can use a algodon with alcohol, and then we have to put a bow around the arm to make pressure, and then
I'm sorry, it is the
it's bite.
bite.
Okay.
Yes, it
Okay.
is a bite.
Okay.
And when you're referring to algodon, it's cotton. Don't forget that.
Okay. Okay. Okay, then that we put the bow around the arm, it has to make pressure on the arm. And then we can ask the patient to do this thing to squeeze his hand to make more visible the veins around his arm. And then localize the vein and the trajectory of the vein. That is really important so we can make the correct insertion of the needle. And then we always have to be very clean with the procedure. So we have to show the patient that we're using new needles and that things. And then we open it in front of them. And of course, we have to put the gloves on us and then start doing the procedure. So we're gonna put the needle in the vein and we're gonna see a little return of blood in the needle, and then we're gonna suction a little bit of blood. It depends how much do you need. We used to do like 3 mLs or maybe 5. And then we have when we stop doing that, we have to take the bow that we put around the arm, because if we take out the needle and the thing, it's gonna bleed a lot. So okay, we take that, we take the bow, and then we took the needle too after that, and then we put a little cotton on the vein, and that's all.
Okay. Yeah, that's how I remember that too. And I want to know which ones were the difference between the one you described today and the one we saw yesterday.
Actually, was the same, but with another words. I think that the words that we used in the presentation maybe are more like medical vocabulary, because I explain right now like an easy form to understand the procedure.
Yeah, that's okay. But don't you remember that here you had to learn a lot of vocabulary? So in the future, try to remember these expressions and words, please. I will be so happy for you if you can do it. Okay. I know you
Okay.
know the procedures and everything, but it would be better if you remember some words every time more. Okay.
Okay.
Okay, Belen. Thank you. Yesterday we were talking about an endoscopy and an enteroscopy, right? I don't know if you
Right.
can tell me again the main difference between these both.
What me? Sorry, it could. I can hear you the
Okay,
last part.
don't worry. I want to know if you can tell me the differences between the endoscopy and an enteroscopy.
Okay.
Like yesterday you said, right?
Yes, the girl said. I really didn't know until yesterday. So it was that the enteroscopy was no, the endoscopy was for the upper part of the digestive.
Digestive system.
Yes, digestive system, and the enteroscopy was for the lowest digestive system.
Okay, that would be a main reference, right? Another kind of difference that you see in this in these procedures, what would it be?
What me? Sorry, what's the question?
What would it be? Another kind of differences between these procedures.
Okay, that on the endoscopy, I know that some are with a wake up patient, and the enteroscopy they used to sedate the patient a lot to keep like
Produce.
yes to go into the bowels. It's more invasive than the
Okay.
endoscopy. And yes, I think that's well I know.
Okay. So in which cases, uh-oh, do you hear me?
Yes, I hear you,
You
but
freeze.
yes, I think that my internet is
Hey,
really
Belen.
hi.
Okay. Can you listen to me right now?
Yes.
Okay. So I want to know in which cases would you recommend this procedure, an enteroscopy or the other, an endoscopy? In which cases?
Okay. Maybe an endoscopy we can do for patient that has bleeding inside, that is bleeding. Like if we want to detect if they have like uh, how can I say, like hematemesis or that things, because when we blood inside, we need to see if there are varices or what is happening. Maybe it can be ulcers and that things, or maybe tumors or how can I say yes, or for biopsies, we can use this procedure.
Okay. It might be an enteroscopy, right?
Right.
And the other one?
And the endoscopy is also used for that. We can see tumors, we can see bleeding too, we can see the ulcers. That was actually the ulcers. I think that it's more for for the endoscopy than from the enteroscopy. The enteroscopy is for seeing, I don't know, that the Crohn's disease and that thing. So
Okay, that's good. And now that we know some more things about an X-ray, um, imagine that you have a patient and you have to explain to your patient what an X-ray is and what are you going to do with that?
okay, I will say that an X-ray it's an image that is a capture of your system. Also, an X-ray detects the lungs. We can see that if they have any problems like pneumonia, or for COVID, that is the common uses in this. Well, actually, in this time, it's really use the X-ray. Then that it's not going to hurt, that he has to be very calm. And when I will say like, okay, stop breathing, so he's gonna stop breathing to stay very calm and quiet and everything. So it's gonna be a better image. And then we can see also, I don't know how to say it really in Spanish. I say in English? Like we can see for accidents, we can use that too to see, I don't know, pneumothorax and that thing, so we can see that.
Fractures?
Fractures too. Yes, fractures too of the ribs. We can say, we can see a lot of things actually. We can see the aorta, we can see the size of the heart. And well, it depends of what is coming the patient to explain what we are going to see.
Okay, thank you, Belen. And what about now that we have the problem with this disease that is COVID? Did you have the chance to Belen?
Hi, Miss. I think you're free to. Hi. Hi.
Hi, Belen. I'm so sorry. I think it was my internet now.
Okay.
Okay, the last question then. I was telling you or asking you about nowadays that we have the disease on our doors. How about COVID? Did you have the chance to watch some X-ray, and how does it look?
Yes, I saw the X-rays of patients with COVID, and it's horrible. It's like all the things and the plate is white. When in so much cases because of the pneumonia that it's taking a lot of parts of the lungs, and we have some places with consolidation, and we can see the what is going on there, and when we're going to intubate a patient too, it depends on how is it.
Wow. And I have a question about that. Is it reversible?
Yes, in so many cases, and it's not invading all the lungs, because the cases I saw were really extremely, but it can be reversible if it's not consolidated. We have the pneumonia, and with the antibiotics and all the the cares that the personal health does, it can be fine. That's why the most of people really didn't know that they have COVID, because we have the asymptomatic patients that even they didn't present like like fever, or maybe they didn't cough. So it depends. I think that, but it's reversible in so many cases.
Okay, well, that's a good notice in some cases then. Okay, Belen, I will send to you my questionnaire, please. Fill
Okay.
it for me. Thank you, Belen. I don't know what happened with my internet. I couldn't hear you very well.
Okay.
And we have left a few minutes if you want to talk about something you want to.
Oh, okay.
No,
Yes.
we don't have.
Okay. Bye, Miss.
Okay,
Bye,
Belen.
Lily.
Thank you very much.
Hi,
See you
teacher.
tomorrow at 6. Take
Hi,
care.
Belly.
Bye-bye. Hi, Lily.
How are you?
Hi, Lily. How are you?
Very
I'm
good.
so sorry about the changing schedules. It was because Ale has some trouble with her internet, and we had that space, that blank space. So I thought that we could change schedules, but it wasn't a good idea. I know that you have things to do. Okay.
Okay, teacher.
Okay. How was your day? How was your work?
It was a day very hard. I attend a lot of patients in the moment. I am very tired.
Oh, Lilia, I'm so sorry you had such a day. There were so emergency cases then.
Yes, teacher. Cases in the emergency.
Okay, and which one was the worst?
I attend 14 years old woman and with 33 weeks of gestation, of weeks
Okay.
of gestational, de each gestational, no sé cómo decir, I don't know.
Okay. She was pregnant about 3 weeks.
3 weeks.
About
Then
3 weeks of pregnancy.
with 33 weeks of pregnancy.
Oh.
30 weeks.
Mm-hmm.
Then
so young.
Then I broke the membranas ovulares before time, and born a child, a premature child.
Wow, so you bring somebody into this world. So that's so good. Such a good day, I think. Okay, you can use that expression as ovular membranes.
Ovular membranes. Ovular membranes.
Yeah, and you can say also this girl has 33 weeks of gestation.
Yes. In the moment, it's raining a lot of. He,
It's raining?
I don't listen. I don't listen when because
Oh,
I'm raining terrible.
okay. So it was raining so hard just 30 minutes ago. Maybe it's almost the same in your country now. Okay, Lily. I wanna know, since we saw some topics yesterday, I want you to explain the taking blood procedure.
Procedure, which procedure? I don't listen, teacher.
I'm sorry. Can you explain the taking blood procedure? Blood procedure. Okay, I sent to you into a message.
The blood procedure.
Can you describe it for me or explain to me?
The blood procedure. Los valores normales de procedimiento sanguíneo. Ah, ya.
No.
Procedure, the blood procedure.
No.
The extraction of,
Yeah,
of blood. The extraction blood is a procedure when the node, generally the node break out the blood. The first, she relates the antisepsia and asepsia about the area. Then she used the badge, the torniquete de la banda band.
Yeah.
The band. I don't remember the expressions.
Okay, don't worry, continue.
After given a patient that relates a fix for find the vein easier. After insert the nails in the vein. Nails in the vein and extracting the blood. Finally, she sent the laboratory the specimen.
Yeah, specimen tube.
The specimen. Nothing else.
Specimen top. The specimen top.
The specimen top.
Yeah. Okay, that's good. Okay, Lily, that's good. I want you to explain the main differences between an endoscopy and an enteroscopy. We talked about that yesterday, remember?
Yes, teacher. The endoscopy is the procedure when the clinicians look for the disease in upper digestive, and colonoscopy. It's the procedure when the clinician look for the disease in the lower digestive.
Lower digestive system.
Lower digestive system. Lower digestive system.
Okay, that's so good. I want to know if an enteroscopy is the same as a colonoscopy. Is the same?
Enteroscopy. Yes, it's the same. Enteroscopy is the same.
Okay. Okay, Lily. And in which cases would you recommend an endoscopy or an enteroscopy?
The endoscopy recommended, it's recommended for patients with pathologies, for example, bleeding, digestive, dysphagia, ¿cómo dice? Chronic gastric. And colonoscopy is used or is recommended for patients with present symptoms like hematochezia, constipation, obstruction, and chronic anemic for discard the cancer in the bowels.
Okay.
I don't know.
It's okay. It's okay. Those are good examples. I'm writing into the message place dysphagia or dysphagia. Okay.
Dysphagia.
Dysphagia.
Dysphagia. Okay, teacher. I don't listen, teacher. I don't listen. Your phone needs to off.
Can you see the questionnaire, Lily?
Ya. No te escuchaba, teacher. I don't listen. Your phone
so
is
sorry.
turned off.
I was muted. Yeah. Okay. Do you feel it? The questionnaire?
The questionnaire? You don't send the questionnaire yesterday. I don't view the.
Yesterday, yes.
Ay, teacher.
You don't remember?
Sí, pero yo no lo miré. El de anteayer sí lo había llenado. Ahorita lo lleno. Excuse me, teacher.
No, don't worry. No, I'm talking about this questionnaire, the diary one. Here, can you see it now?
Can you... ¿Estoy sentada ahora?
No. Can you see the questionnaire in your screen? I sent to you.
Ahora lo busco. Yo no lo miré.
No, don't worry. I'm just asking if I'm sending to you my diary questionnaire, remember? You put some specific answers on this, like the qualification of the class.
Ah, no, teacher.
You don't see it?
No.
Oh my God, what happened with that? Okay, I will send it again. I'm sorry, Vanya. I'm making you wait.
No problem, miss, no problem. Hello, Lily.
Oh, thank you. Lily, can you see it now?
No, teacher.
Oh my
I
God,
don't see.
it cannot be.
No, teacher.
Okay, just one more time. And if you can't see it, we're just making another way, okay?
Okay, teacher.
Okay, can you see it now?
No,
Oh my God.
just the camera. You and Vanya. I
Vanya,
don't see nothing.
Vanya, can you see the questionnaire?
No, miss.
Okay, I don't know what is going on, but I will send to you the questionnaire then, Lily, at your cell phone, and you will mark it, okay?
Okay, teacher.
Please. Thank you so much. See you tomorrow then. Take care and get rest.
Thanks, teacher. Have a good night.
You
Bye
too.
bye,
Bye,
girls.
Lily. Bye-bye. Okay, hi, Lily. Good afternoon. I'm so sorry about the change in schedules. It was because Ale has some trouble with the internet, so she couldn't do it. And I thought we can reschedule, but it wasn't possible. Okay, so how was your day?
My day was busy in the morning.
Yeah,
In the
but
afternoon,
after that it was good.
relax.
Okay, that's so good. Uh, I want you to explain to me, please, the taking blood procedure.
Okay. In generally form, we explain the patient the the procedure, and it is asepsia and antisepsia
Uh-huh.
in the leg, and we need find a good vein, but the venipuncture. After the asepsia and antisepsia, there's a venipuncture in a good vein on the or a notable vein in the patient. Usually, extract about 10 mLs or for blood. It depends the solis the exam we need. In some case, only need 5 mLs, but usually it says 10 mLs. After the extraction of blood, we deposit torunda, or yes, in the place of the venipuncture, and we realize some pressure in the place. Yes, generally
Okay,
procedure.
that's basically how you do, right?
Yes.
Okay, that's so good. And I want you, well, explain it to yesterday. How was or which was the differences? Which were the differences between endoscopy and enteroscopy? Can you say it again, please?
Okay, endoscopy is a general procedure.
Mm-hmm.
It is introduce a tube with a video in a tube, yes. Endoscopy is divided in two parts. Video endoscopy upper
Mm-hmm.
and the tract digestive upper, yes.
Okay.
CNC mouth, esophagus, stomach, and duodenum,
Uh-huh.
yes. This tract. And the colonoscopy,
Mm-hmm. It's the same as enteroscopy, colonoscopy.
colonoscopy.
It's the same as
Uh,
enteroscopy.
yes, it's the same because the procedure
Oh,
is look for injuries with a video,
on the bowels.
video, yes. And
Okay.
the tubes in the video endoscopy upper and the colonoscopy is different because the diameter in the
Diameter.
colonoscopy
Yeah.
diameter is major in the colonoscopy, and it's a procedure. ¿Qué es pain?
Painful.
Painful. Yes. Um, Ever require anesthetic and pre-medication after the procedure.
Okay. Okay.
Colonoscopy is
That's,
very annoyed for the patients.
yeah, I think so. It seems to be. Okay.
Mm,
Just a little observations. Stomach, not stomach,
yes.
stomach. Yeah. And tube. When you're talking about the tube that you're getting inside, it's tube. Okay. Then I was, yeah, I think it was all. Okay, Vanya, that's so
Okay.
good. That was a good explanation. Okay, so in which cases do you recommend uh, the endoscopy and the enteroscopy?
Okay. Endoscopy is very important in patient with diagnose bleeding in the hemorrhage in the hemorrhage digestive upper. When the patient has a ulcer in their stomach. Um, Sometimes the patients have bleeding and with their vomit, and it's indication for the endoscopy. Sometimes patients has problems with relations with Helicobacter pylori. Is
Okay.
a microorganism who cause gastritis chronica, and it's very important take a biopsy um, to find Helicobacter pylori. In case if they suspect neoplastic problem, too,
Mm-hmm.
it's important endoscopy. Um, in childs when take some uh, objects extract, yes, they they I
In hair?
yes, in her some things strange, such as coins, plastics, and yes, this procedure strange, the corpse strange. Yes, it's the most common in the tree. Hemorrhage, um, mm, ¿cómo es esa enfermedad? Acid peptic disease.
Uh-huh.
The neoplastic, yes.
Okay, that's a good explanation too. So good, Vanya. Just to let you know, you can say ingestion, when someone it swallows, right? Swallow is the other word. We learned yesterday, remember? And the plural of child will be children.
Yes.
Okay, don't worry, I know we can forget those silly things. Okay, and I have one last question about X-ray topic. Okay, imagine you have a patient, and you should explain what an X-ray is and what is the procedure that you will use, or the technician in this case, but you will explain to them.
Okay. We need take some X-ray plate. So you'll need collaboration us.
You need to
Collaborate us. Yes. If the plate is a RX thorax, it's a specific position
Okay.
in the equipment. Suppose, and when you are in the X-ray bed, in the X-ray room, you need stay how you say,
What?
parado.
You have to stay up in
Yes,
front of the plate.
yes, in front of the plate, before you dressing with a bait, with a bait, or
Yeah.
a lighter cloth, a specific cloth in the room.
Okay.
You don't take dressing, neck,
Hospital gown.
jewelry, hospital gown.
Hospital gown. I'm gonna write it
Go.
on the message. Okay, and you continue, please.
Okay, well, if the patient is a female, only dressing the uh, hospital boat,
Gown.
hospital ground,
Mhm.
hospital ground, um, and if they have jewelry, neck wear, they
They have to
it's
take it
for
off.
take it off the jewelry and the cell phone or some device in the pocket. The prop. Yes,
Because you had
and
an experience.
yes, when you are in front the plate, you need breathe breathe deep
Okay,
for
you
a
you
few
have to
a few
deep
seconds.
you have to make a deep breath.
deep breath. Deep breath for a few seconds. And we say you when breathe normal. In the moment when you deep breath, we take the plate when they're X-ray, and you don't move. It's very important.
Okay, there you go. You have to take a deep breath. You were saying good, but on the other side, okay? Breath deep, right? But it's a good way. Okay, okay, Vanya. That was a good explanation. You is I'm watching you, and I know that you try to use every time a new word in medical expressions and everything, and that's so good. You have to learn and remember those definitions. Okay, that's so good. Okay, Vanya, thank you very much. I hope my questionnaire it's been so. Did you see
No yet, miss.
or no?
No.
Oh, what happened? This. Okay, I'm gonna send you again.
No.
Okay, maybe now?
No, miss.
No, I cannot believe it. I don't know why. Maybe the internet. I will do it once again, and if not, if we cannot do it, I will ask you, please. I will take a picture and send to your cell phone. You can mark with the number you want, and you can send again to me or to Allison. It's okay for you?
Okay, miss.
Okay,
Okay.
now?
Where now in the computer? No. In my cell phone. I,
No?
my cell phone. Not.
Not? Okay, now. This thing won't work. Okay, let's do it that way, okay? I will send to you your cell phone, and you can mark it there, and then send to me and send to Allison if you can, okay?
Okay. Okay.
Okay, the Allison number is on the group, by the way. I will,
Alison Lara.
yeah,
Okay.
okay. Thank you very much, Vania, and
Miss,
tomorrow. Yeah,
please, tomorrow I'm going to 30 minutes late, please.
okay, don't worry. I know you are busy some days. Don't worry, okay? Just try to watch the recording since the first minute. I don't know when you have time left, okay? I see you tomorrow
Okay.
then at the time you can
Okay.
get in, okay?